Hi everyone, this is Dr. Patterson, and this lecture is an overview of Chapter 5, the Cultural and Spiritual Assessment. Culture is broadly defined as the system of shared ideas, rules, and meaning that influences how we view the world, experience it emotionally, and behave in relation to other people. One's culture defines many different healthcare variables and perceptions. It defines how healthcare information is received, rights and protections, what is actually considered to be a healthcare problem, how symptoms and concerns about the problem are expressed, who should provide the treatment, and the types of treatments to be given. There are many examples of this, but one that comes to mind is, in some cultures, illness is the result of negative behaviors and as a form of punishment. Also, some cultures view the hierarchy of the family as significant in making healthcare decisions. For instance, the eldest male may govern the healthcare decisions. Also, certain religions or cultures do not condone the administration of blood or blood products. It is important to know that although a patient may be from a certain culture or a part of a specific religion, there are also individual variances, and you can't lump and categorize patients into one single group. That is why it is so important to individualize your patient care. Within a cultural assessment, it is imperative to examine and respect different individuals, families, groups, and communities regarding their health-related cultural beliefs, values, and practices. This comprehensive review helps us to form the foundation for a patient's plan of care, allows us to set mutual goals, interventions, and evaluations. It is essential to utilize social determinants of health to identify and recognize vulnerable populations. In recognition of healthcare disparities, we can work toward eliminating and utilizing our resources. An example of this are the goals of Healthy People. As nurses, we want to utilize accessible, equitable, and culturally competent healthcare to promote the quality of life for all people. I would encourage you to look up Healthy People 2030 to explore the different goals that are outlined and how it relates to your nursing practice. Cultural awareness includes an understanding of diversity, as well as self-awareness about one's own culture. Awareness is not a stagnant thought process. It is ongoing and involves all members of the healthcare team. Performing your own cultural self-assessment is an important part of becoming culturally competent and allows an increased understanding of oneself and your own belief system. Cultural competence recognizes the need for set skills necessary to care for people from different cultures. It is vital to explore your own personal history to develop this deliberate cultural sensibility. Think about your own lives and your own day-to-day activities. Also think about your own values and beliefs and acknowledge their importance. It is when we think about our own daily lives and recognize our own belief systems that we are fully able to help others. Cultural humility is a process that requires us to engage in self-reflection and self-critique as lifelong learners. These boxes outline the different questions you may ask yourself when thinking about self-reflection. I would encourage each of you to think about these questions and reflect on your feelings regarding these questions. As we talk about the transcultural perspectives, it is important to consider the cultural variations in communication. It is important to be aware that time spent in social conversation, silence, distancing, eye contact, use of touch, gestures, and modesty can all vary between different patient cultures and populations. For instance, while we may think maintaining good eye contact and use of touch is important for communication, some cultures may see this as a sign of disrespect. There are many cultural assessment tools, but there is not one tool that addresses all the variables of culture. However, thinking about these tools, it is important to not allow stereotypes to interfere with competent care. It is important to listen to your patients and think about their heritage, health practices, and communicate appropriately. There are different family roles and social factors that may influence nutrition, pregnancy, birth, child rearing, spirituality and religion, and death. It is important to be aware of how all these variables can influence cultural assessments and care. To elaborate on the transcultural perspectives, again, patients may interpret their symptoms per their cultural view. For example, their symptoms may be attributed to actions of another individual or the actions of themselves. We will discuss pain in a later lecture, but I really want you to know that different cultures can have different manifestations or expectations of pain management. This can include silent suffering. This question asks, when learning about a patient's culture, it is important to avoid using A, humility, B, stereotyping, or C, collaboration. The answer is B, stereotyping. Stereotyping is often the result of misguided beliefs and should not be used to determine a patient's beliefs. There are differences between religion and spirituality. Spirituality is a broad term that encompasses something larger than one's own existence with a belief in transcendence. However, religion refers to an organized system of beliefs that can be one's spiritual needs. These two concepts are interrelated but do not have to exist simultaneously. Feelings and beliefs are defined on an individual basis. That is why it is so important to listen to our patients and to be present with them. When thinking about our nursing presence, we can think about this as often what patients value the most. While we are present, it is important for us to listen and not to always be speaking. We need to be attuned to nonverbal cues of discomfort or affirmation. We also need to encourage the patient to express their feelings and concerns. It is helpful to assist the patient with identifying the problem and resources used in the past to cope with different problems. For example, we can ask, is prayer helpful for you? After we discover what is helpful for the patient, we can then focus on providing them with resources and support. In thinking about the different religious practices, for example, if you are in a hospital setting, a consult with a chaplain may be helpful in matching a patient up to a specific religion, denomination, or just simply to serve as a source of comfort based on the patient's preferences. In addition to the comfort you provide as a nurse, chaplains can come by and pray with patients, talk with them, and/or listen and help provide them with other resources that may be helpful. In summary, as nurses, we can greatly aid in healing by just being present, listening, and providing comfort to our patients. Knowing our resources can help us become more confident in caring for patients from varied backgrounds.